Hi, my name is Amber Stamatis, and this presentation is on using duplex ultrasound to monitor asymptomatic carotid stenosis. Atherosclerosis is a disease leading to plaque buildup in the arteries. Plaque located in the carotid arteries is a major risk factor of stroke and one of the leading causes of death in the United States. Patients who are asymptomatic may have a stroke or TIA as one of their first symptoms of carotid artery disease. This case demonstrates the importance of monitoring the progression of carotid artery disease while using the non-invasive modality of duplex ultrasound. Atherosclerosis is a degenerative disease of the arteries that leads to decrease in blood flow. Plaque consisting of lipids, necrotic cells, and cholesterol crystals build up on the arterial walls, causing risk of thrombosis, embolism, or full occlusion of the artery. In an asymptomatic patient, a bruit may be heard during a routine medical exam. The duplex ultrasound of the carotid arteries is often ordered to rule out stenosis of the carotid arteries. In this case, we have a 79-year-old male present with a known stenosis, and he is asymptomatic. His last comparable ultrasound duplex exam was from 2013, and the most recent is from April of 2016. On the right side, there was minimal amount of plaque visualized in the CCA, the ICA, and the ECA. No measurements were taken, and the peak-systolic ratio was 1.0. The right vertebral flow is antegrade and within normal limits. The left side indicates intimal thickening in the CCA, with hyperechoic irregular plaque in the proximal ICA measuring at a 64% stenosis. There is a high peak systolic velocity of 242.9, making the left peak systolic ICA-CCA ratio at a 4.7. The left proximal ECA also has the highest peak systolic velocity of 435.3 due to the heterogeneous irregular plaque in the proximal ECA. The vertebral flow was antegrade and velocity within normal limits. The proximal ICA and ECA on the left side both have velocities that are twice as much as in the previous study from 2013. For patients with carotid artery disease, and especially with a known stenosis, it is important to monitor, and using duplex ultrasound is often used due to its lack of radiation and the lack of contrast dye used to visualize the vessels. A review of non-invasive imaging found that duplex ultrasound has an 86% sensitivity and an 87% specificity for diagnosing a significant stenosis greater than 70%. Mild to moderate disease is considered 30 to 50% stenosis, and that indicates the need for ongoing surveillance, as well as medical management. Medical management consists of aggressive treatment of risk factors such as smoking, hypertension, hyperlipidemia, high blood sugar, as well as taking an antiplatelet medication. The usual practice is to surgically treat patients who only have a greater than 80% stenosis. Granted, they are healthy enough to be considered a low risk for complications. When unstable or ulcerated plaque is seen or a large increase in diameter of a known stenosis, the patient should then be referred to a vascular specialist. It is recommended that at least 2 modalities be used to confirm the degree of stenosis due to the fact that each modality can report either false negative or false positive findings. A few other modalities that are used to visualize carotid arteries are magnetic resonance imaging, known as MRI, and computed angiogram tomography, which is CTA. This case demonstrates the need for carotid artery disease, especially in an asymptomatic patient with a known stenosis. Medical management is a way to decrease risk factors and stroke until intervention is needed. Duplex ultrasound is a good way to monitor carotid artery disease based on its non-invasiveness as well as its specificity and sensitivity.